Palpation of the abdomen includes left upper, heart, spleen, kidney, stomach, lungs, left lower, bladder, colon, right upper, liver, pancreas, kidney, lungs, right lower, appendix, bladder, and the colon. You are palpating for rigidity and tenderness of the organs.
The test for rebound tenderness is done at McBurney's point, in which the clinician presses down on the appendix and pain is felt on the release if the patient has appendicitis. Percussion of the abdomen is done with the patient lying supine on the table. The clinician places one finger a part of the abdomen, and then the opposite hand will tap the one finger. Then continue to move the fingers around to assess the entire abdomen. This allows the clinician to assess any hard, solid sounding echo over areas that should normally sound hollow.
Auscultation is done to the bowels to assess sounds or absence of sounds. Absence of bowel sounds can mean there's a blockage or the bowels are not functioning properly. Percussion of the intercostals includes tapping on your middle finger with your pointer finger to evaluate sounds of percussion. Sounds should seem hollow and the same bilaterally. Differences in sounds heard could be injury to the intercostals or injury to the lungs, a hemothorax or pneumothorax.
The clinician can assess the patient laterally to see if the patient has kyphosis, which is an increased curvature of the cervical spine, or lordosis, which is an increased curvature of the lumbar spine. When assessing the posterior aspect of the patient, the clinician can see if they have a fawn's beard. This would be a small, hairy patch on the back of the patient if they had spina bifida. Adams test is done where the patient bends over and the clinician assesses the alignment of the spine. This can be done to identify if the patient has scoliosis, which is a lateral curvature of their spine.
To assess for respiratory assessment, the clinician will first look at the patient to see if they have an increased or decreased rate of breathing. Once done with that, they will place their hands on either side of their ribs to assess for rise and fall as well as smoothness. Count to see if increase or decrease in rate of breathing. This allows the clinician to assess their condition.
Lung sounds can be assessed on the anterior aspect of the patient. The clinician uses the stethoscope and touches the patient in 5 points of interest and checks bilaterally to make sure that the lungs do not have any abnormal sounds. This is done while the patient breathes in and out to assess the integrity of inhale and exhale. Lung sounds can be assessed on the posterior aspect of the patient with 5 points of interest, in which the clinician moves the stethoscope to check breathing sounds bilaterally. The patient is asked to inhale and exhale deeply so that the clinician can assess the integrity of the breathing, making sure there are no abnormal sounds.
Heart sounds are assessed for the aortic, pulmonic, tricuspid, and mitral valve opening and closing. A good way to remember this is apple pie taste The clinician is listening for a murmur or valve prolapse, and it'll sound like a wispy sound because blood is coming back or washing back into the valve.